Thank you for your patience while we worked out this technology. So welcome to this session of the 2024 Northwest Interlibrary Loan and Resource Sharing Conference. Today's date is September 18th, 2024. This session is titled Feeless ILL, Fright or Flight, Results from a 6-Month Study. Our presenter today is Allison Martinson Hayes from the University of Utah, and I forgot to ask you how to pronounce your library's name.
It's the Eccles Health Sciences Library.
Okay, thank you, Eccles. So please let me know, or my name is Jean Dolag, and I'm your convener. Not a techie savvy one, but nonetheless an enthusiastic one to have you work with Allison today. This session is being recorded with permission from the presenter. We plan to make the recordings available once the captions have been added. Expect an email from Whova when the recordings have been posted. That's about 3 weeks' time. We will take questions from the room and from virtual attendees on Whova. Our virtual colleagues should post their questions in the Q&A tab. And don't forget to vote up your favorites. After the session, please complete the survey to enter our prize contest. If anyone in the room is logged into Whova, please remember not to start the presentation on your device. That's if you're in the room, because it'll be feedback, I guess. I don't know, that doesn't make sense. But anyways, and now I will turn you over to Allison.
Thank you. Hi, everybody. Thanks for coming to my session. My name is Allison Mortensen Hayes, and I'm representing the University of Utah, the Spencer S. Eccles Health Sciences Library. Today, I wanted to speak about a trial we did from July to December 2023, wherein we committed to free ILL services. And by free, I mean no charges issued to our patrons at the University of Utah, no charges issued to libraries we lent to, and as much borrowing from free sources as possible. To give you some idea of context, we are kind of a smaller team under the umbrella of Access Services. I'm the only full-time staff member whose role is entirely dedicated to interlibrary loan. Other team members are with the public services side and include 1 full-time, 3.75 time, and 2 part-time employees who do ILL work. We use ILLiad, OCLC's WorldShare, and DocLine. We have a little bit over 12,000 holdings in WorldCat, over 17,000 in 17,000 in WorldCat, 12 in DocLine. We've averaged between 10 to 11,000 requests per year and are a net lender. And somewhat uniquely, the vast majority of our materials, so books, journals, it's all electronic at our library. So it's extremely rare for us to be lending a physical book from our collection. And we don't do a lot of going to the stacks to grab items to scan. And because we serve a health sciences patron base, most of what we're asked to retrieve is also things that can be transmitted electronically. In terms of charging, we stopped billing our U of U patrons in 2016 unless we were asked to be part of a large project such as a systematic review, wherein we are asked to retrieve 50 or more items at one time. In lending, before the trial, we were charging $11 to $16 per request, unless the borrowing library was part of one of our regionally based reciprocal agreements. And given that we stopped charging our own patrons, the way that we survived borrowing costs was collecting that previously mentioned lending fee. And being a net lender, it worked out that way alongside our yearly ILL budget. However, on top of those financial sources, we have often relied substantially on libraries who lend for free. There were and are libraries that lend to us freely because of those regional reciprocal agreements, but there were other libraries who are not affiliated with us in any way, and they just lent for free anyhow. Without their support, I am pretty sure our budget would have suffered and our accountants would be unhappy. So thank you. So with that said, I want to briefly address the long-standing custom in our ILL world of charging lending service fees. Um, it's embedded into our software, and we have entire billing systems created around this. It's become a standard and expected phenomena. Um, while we probably don't think twice about the normality of it, I still think it's valuable to examine. Truly, why do libraries charge other libraries? Well, I put out a survey on Whova before the conference, and I got some answers shown here that confirm my basic suspicions. Some libraries are using these lending fees to cover library services, functions, and staff, and that's absolutely important. However, I have a feeling that there may be a lot of other libraries who are in similar positions as we were in before the trial, which is it was the way it was set up. It was working fine, and we needed those lending funds to cover our borrowing requests because folks were charging us. So, in essence, that's the way it's always been, and folks charge because they're charged. In any case, eventually I wanted to trial us becoming a free lender to see how we could get back to those kind libraries who helped us in our past. It really didn't feel good getting what we needed for free, but then turning those same institutions away when they needed something and didn't have funds to offer. It didn't feel good contributing to draining hospital and library budgets. And after all, isn't the purpose of a library to share materials with as little of a barrier as possible? Shouldn't we try to support each other as colleagues? And if we don't like charging our own patrons, which we don't, why would we cling to charging your libraries and perhaps your patrons ultimately if we don't have to? In the spring of 2023, I began doing some research to prepare a proposal to library administration. I looked at libraries who are in existing free groups and was happy to see we would not be the only large academic health sciences library. I then reached out to these free libraries through our community emailing lists like DocLine L and ILLL to solicit advice, concerns, and workflows. While that was more of an open call, I also purposefully reached out to libraries I found in most similar positions as ours. There were no major warning signs from anybody I talked to, and the just general vibe from those conversations was overwhelmingly enthusiastic. I took this information to a couple of meetings with library administration where I was able to answer any questions, concerns that came up. While there was initially a bit of hesitation from our accounting, walking into that space with a clear vision led to an agreement that we could just do a trial to see about us dipping our toes into the water. It was decided that the trial would begin with our new fiscal year on July 1st and tentatively run the rest of the calendar year. And admin were relieved by my repeated reassurances like, if this goes terribly wrong, we can revert at any time. To prepare for the trial, I first started by saving documentation on how everything was set up before I made any changes. I then made an extensive strategy. I needed to plan all the steps needed without a ton of formal guidance on how to make our software and requesting systems functional. For example, we needed to make sure the charging box isn't coming up, invoices are not being created, and we wanted to state on our borrowing requests that we were doing this trial so that folks wouldn't charge us that might have done so otherwise. So here's a closer look at each of these kind of settings changes in each system. With Iliad, I started by unblocking about 125 libraries in our system who we previously flagged as not offering enough money per requests. And I asked OCLC support to run a query on the eve of June 30th to change all library profiles in our system to exempt in their billing categories. However, I really don't advise doing that because there's actually a simpler way, which is going to the customization manager for Iliad and marking lending billing as no, much less maintenance. In WorldShare, I started with the policies directory settings for both photocopies and loans. This required getting to the edit mode and changing the fees in each category to 0 and changing our billing methods to bills not issued. I then turned to our constant data so I could make our borrowing max cost 0 as the default and provide a note on each request that we were doing the trial. I left the ILL fee management or IFM checkbox marked because if a library tries to charge above that, the system just automatically negates the charge and it is a protection of sorts. And importantly, I created 2 new custom holdings groups. So when we were getting ready to order things in borrowing, we could isolate these free lending options. One of the groups I created was for Elvis Express libraries, and the other was non-Express, Elvis, or just non-affiliated free lenders that we found. And both of these groups are still continually updated. And these changes were done through the WorldShare interface. DocLine, for anyone who isn't aware, is a requesting system put forth by the National Library of Medicine, and it's extremely helpful for health sciences libraries and hospital libraries like us, and it's actually what we use primarily. In the Manage Library section, I did the borrow defaults to set our max cost to 0 and our routing defaults to turn off routing to EFTS libraries only. I also looked at our routing table to make cell 1 nothing but free share group, then no further routing until I could take a look at what all the options are, at least during the beginning of the trial. And lastly, for these settings changes, I knew I would have to go into EFTS, which for anyone that's not aware, EFTS is essentially the IFM equivalent for libraries that use DocLine. So I knew I would have to go in there on a monthly basis or more frequently to highlight all unbilled lending requests, set a bulk price of 0, and approve, because otherwise, if left unmonitored, our previous billing defaults would stick. And there is an auto bill feature in EFTS where you can just set it to go with no billing, but it being a trial, that was something we didn't explore right away because we didn't want to make too big of changes too quickly. Essentially, I did as much research and preparation as I could to ensure that this trial would be going smoothly. The kind of nightmare scenario we had in our head before the trial was that our budget could drain instantly and our University of Utah patrons would be kept waiting and our lending request volume would spiral completely out of control. But I'm happy to say none of that happened. Come July 1st, it was time to move beyond this theoretical preparatory phase and just see what feeless life was like. So we joined 2 feeless groups, OCLC's Elvis, which is standing for Libraries Very Interested in Sharing, and DocLine's Free Share. Staff were trained on how to use the custom holdings and coached on what to do when various scenarios occurred, like what if I go to order something and there's no free option really showing. Off the bat, there were some significant changes that we saw, so I'm just going to break things down piece by piece, starting with borrowing. So as you can see from the data, borrowing wasn't really affected in terms of request volume or amount going unfilled. And I was happy to see that our turnaround time was not significantly impacted. Essentially, the only thing that changed is that we were getting things we obtained from new sources. And I was happy to see some of the things we could get for free, like a super pack of multiple test prep booklets, 17 ebooks requested by one person with a same day expectation of turnaround, and a couple of obscure special collections scans where folks had to retrieve that from print because it doesn't exist elsewhere. Conversely, there are some titles we had trouble finding free lenders for, and this kind of continues, especially with Bentham science publications that we see, some rarer international titles where it basically seems like the National Library of Medicine is the only holder of the item that we can find, and just some specialized titles like International Journal of Computerized Dentistry that just are not widely held. For these, I created a document that's sorted alphabetically so that we can quickly log when we're not able to find a free option. And on a quarterly basis, I do a little bit of research to see if there is a free lender for these repeat options that just isn't quite apparent. And I have been able to find some of these titles in that method. While we can always expect we're going to have to pay for some things, I hope by sharing this information and maybe talking about this with you all, maybe more free lending will become normal and we will all be stronger for it. So looking at finances now, from July 1st, 2023 to the first week in 2024, we spent roughly $1,100 on 94 requests. This came out to an average of a little less than $200 spent per month. And postage fees are not represented here. We're just talking transactional request fees. However, this represents only 5% of our volume because we got 1,667 requests, or 95% for free. During the same time period in 2022, we spent over $9,000. So it's fair to say we did way better than we could have ever imagined at the beginning of this trial. And though we did not have any lending fees to put toward this $1,100, we do have a annual budget for ILL services. And I'm happy to say, like, we did not go over our budget. So looking closer at lending now, this is where things really shifted. What I find super exciting is the boom of more libraries that we can interact with, both in lending and borrowing, but just particularly how far our help goes. Since going feeless, we've lent to all 50 states, DC, Puerto Rico, Guam. Literally hundreds of new libraries are coming into our system. And that led me looking at the types of libraries we lent to, comparing 2022 to 2023. What I found is that we went from us serving academia, so colleges and universities, about 65% of the time. It went down to closer to 50. And this made room for 10% more hospitals and small increases in public and specialty libraries. And while the percentage of academia shrunk, the actual number of places we lent to was greater than previously. So we were lending to even more of those than before. I will say that we were already doing great work in collaborations. It's just that this trial really helped to accelerate the new and varied connections. However, while we are proud of how many people we're getting to serve, we can't help literally everybody. And such a substantial lending increase was something that we needed to reckon with. Firstly, this wasn't really a surprise, because when we were thinking about what could happen when stepping into the trial, we were worried that being a health sciences library with so many holdings, it would be kind of like opening the floodgates. And while it wasn't that bad, this is one of the first things we really experimented with, was workload control. During fall semester, we first tried editing our lending operating hours to be closed Tuesdays and Thursdays. And the thought was that we could use our off days to catch up things we previously receded. However, we quickly pivoted to closing more flexibly so that different staff didn't work different volumes depending on the shift, and to actually respond to fluctuations in the workflow as we saw them occur. By flexible closures, that meant sometimes we receded an initial batch, marked ourselves as closed, worked on those requests, and then reopened ourselves a bit later. And since we have two request systems that we work with, Sometimes we would just close one and keep the other open. During the trial, we closed about a dozen times in that manner, and usually for just part of the day. And again, while we were closed, we weren't actually gone. We were just working on what we started with rather than having a continuous flow coming in. I checked with Dockline support to make sure that that's not against some kind of rule, and they assured me that it is not. But I do kind of caution if anybody else were to do that to respect your borrowing libraries and don't abandon requests, but pass them along if you need to. Yeah. Another thing I did was change our days to respond in OCLC from 2 to 4. And by doing that, we did not have to leave the express group because that's based on your actual turnaround time and not the days that you indicate. We doubled up who is handling lending at any given time, and that has been enormously helpful. Our ILL schedule is based on the front desk, and so we have a morning and an afternoon, and nobody is responsible for entire days. When our workload becomes unbalanced at any point, I rely on those options of closing us in Dockline and OCLC, which again is flexible, that I can close one or both. I can close for full days or just a shorter period for more spontaneity. Ideas that we did not explore were further edits to our operating hours, enabling borrowing automations so that staff time was freed up that way, or just dropping out of the big feeless groups and continuing outside of that. And all of those are still options we could explore should the need arise. But we don't believe that it makes sense to use billing as a workload control method because your time isn't actually freed that way. It's just pivoted toward billing. In terms of morale, I regularly checked in with our team, and to date, there's been no concerns with the amount of volume we see. In fact, I've heard nothing but neutrality to positive comments about being a free lender. No one is afraid of the pesky billing box anymore. And I say pesky because if you're an Iliad library, maybe you know when that box comes up, there's no minimize, there's charge, don't charge. And whatever decision you make sometimes isn't clean to fix up later. Staff in public services are working on these requests at the front desk where getting interrupted is just kind of expected. And so taking away that burden has been great. And I've just generally noticed that our team has become more cohesive, checking in with each other more frequently and offering more help more freely. Looking ahead, I submitted development ideas to both OCLC and Dockline for an optional daily lending request quota, and in the hopes that developers will be able to help with request volume control on a systemic level. Both have accepted my idea, and it looks like this really might become reality, though there is no ETA of when that would be released. If enabled, I envision that libraries who handle large volumes of requests will be able to more sustainably operate with the staffing levels they have. I would hope it would help with burnout and stress for ILL workers. And ideally, perhaps it would even encourage more people to consider free lending. Like I mentioned, our journal holdings are all electronics, so turnaround time for a request is much simpler. But with the way systems are set up right now, I could understand that libraries with extensive print collections may not want to join a big fee list group, as they might not have the time to do some of the more careful monitoring and adjustments that we have. But back to the positives and beyond those initial thoughts of reciprocating to those kind libraries from our past, this project is exciting in a number of ways. I see it as our small contribution toward health equity, since by removing fees, we have removed a barrier to information access that can directly impact patient care. This project supports our mission at the library and the Greater University of providing information to and thereby supporting rural libraries, underfunded institutions, and their communities. I was curious and I did some research to see which areas of the country have poor health outcomes, and I found a couple of sources stating that Mississippi ranks lower just in terms of population health and healthcare quality. Pre-trial, we filled a yearly average of 3 requests for Mississippi institutions. And in post-trial, we filled 13 requests in just 6 months. So to me, that's a palpable example of some of the good work that came from this. Unfortunately, we've consistently received a lot of positive reinforcement from the FELIS community, with kind notes coming through to us essentially every day, ensuring that this isn't thankless. To date, we've received hundreds of emails like this shown on the screen, and thank you all for your support. Toward the end of our trial, in November 2023, our library administration took a look at the situation and ended up approving a full permanent transition. We have just a few loose ends to tie up, mostly related to instructional guides. And thankfully, now that billing is out of the way, we have some extra time to devote toward that. After this conversion, we took a look at our practice of billing for systematic review support, because that was the last thing that we were habitually billing for, beyond the rare situation where we borrowed a loan and it was not returnable for whatever reason. So after we examined this, we decided to sunset billing for those systematic review projects. And instead set up some ground rules in terms of turnaround time expectation and priority when compared to requests from the rest of the campus community. The rationale was that if we aren't paying to obtain their items, then it doesn't really make sense to go and pass a charge along to the systematic review teams. And again, doing this kind of work supports our overall library mission. So, after all of this information, you may wonder if it was fright or felicity, and I am going to rule this, even with the hiccups and continual adjustments, as felicity. So thank you.
Yeah. Ask for some questions here, and then we have 3 online. So, stay where you are. Okay, who has a question?
Can you hear me? Okay. Hi, thank you. Wonderful presentation. This question may have been answered by the one patron that requested 17 ebooks all at once. But had you ever considered capping the number of requests from your own patrons, borrowing wise, as like a potential cost control measure?
We did not. Yeah. Another presentation, the newbie ILL presentation, mentioned that there's kind of a tension between serving your own in-house patrons versus external community patrons. We do have a focus on our in-house patrons, and so we wanted to treat them without kind of limiting anything on their end.
Thank you.
Mm-hmm.
Other questions in the room? All right, then let me go to that. Online. There are 3, the last I looked, and they're good ones. Okay, question number 1, which was upvoted 4 times. Do you charge for replacement of lost or damaged material related or to borrowing or lending?
So I don't want to jinx anything, but though I have been in this role for 8 years, we have never had a library we lent to lose an item. They've all came back safe and sound. And in terms of borrowing, we do pay to replace those. And I don't believe we have put that on the patron that damaged or lost the item yet.
Okay, thank you. The next question. Do you look to establish reciprocal agreements with institutions that have journal titles you can't obtain for something? Hold on, I cannot see it. For free, that you cannot obtain for free. Do you,
That is something that I have considered. When I've brought that kind of up to my supervisor and higher ups, the only concern is that, again, this might impact volume, because if one library can supply, say, a couple of titles that come up kind of frequently, and then they rely more substantially on us, that's just the only point of hesitation for that. But it is on my to-do list to actually delve into it more methodically.
commented that for those requiring agreement, why? It delays requests in my experience. I guess the reciprocal agreement question. I don't know. Hazel, if you'd like to clarify that. She's not. Okay, now I got to get back to question number 3, if I can find how to get back there. No, it's not showing up. I enlarged this. I'm clicking here. I'm not getting it. Oh, how about that? Okay, and thank you for the tech help. And the next question. Does it take much more time to create lending strings, submit requests? Do you have to spend more time resubmitting requests that went unfilled in the first round?
So I would say overall, no. With the custom holdings, that kind of takes the bulk of the work out of like hunting and pecking on the OCLC side. And with Dockline, they set up a routing table. And so I'm not sure quite what the mechanics of it are, but you can put people you prefer to ask first up front, and it randomizes the order of who actually receives it. And so once we send things out, no, that doesn't take extra time. The only thing that might take a little bit of extra time is, again, some of those tricky titles. Trying to find a free lender off the bat can be tricky. So that would take more time, but it's not so much that it's led to issues.
I have one more question online, but if there anyone in the room that has a question in between? I can't see any hands, are there? Lars, help me. Okay. And so the next question, it's a comment, I think, more. I've learned to use the item ref field in ILLiad to know how much to charge if I have to. I can move the billing window to the side to see it when I process the loan. So maybe you'll have a conversation with Melissa Jackson. Okay, so remember that if we run out of time or if you want to continue the conversation, you can do so in the Whova app. And looks like it's back to question list. Did I get it? Is this the last question? I think we've got, okay. Here's one. Do you put restrictions on rush or urgent requests? Libraries could use rush status to go to you front of the line.
No, we still fulfill those in kind of order of operations, urgent being number 1, rush number 2, and anybody else number 3. And yes, I think people have griped a little bit that some folks are kind of being like, I want this immediately. And so they kind of abuse that. But I still am trying to operate optimistically and assume that people have good intentions. Yeah, when we're closed, we cannot receive those rush or urgents for that time period.
Okay. All right, I think I've got them all now. Let me check the chat and the thing. All right, again, if you have any more questions for Allison, you can converse with her or ask her more questions in the app. And to close out this, thank you for attending this session. Stand up.
So.
Thank you, Allison. And okay, thank you for attending again, but please complete the